And I am going to go ahead and start recording. So again, welcome everyone. My name is Tricia Zizembo. I'm the Director of Training here at Oakland Community Health Network. And I am joined today by Kate Guzman, who is the Administrator of Medical Services with the Oakland County Health Division. And I want to thank her for coming on and partnering with us to do this presentation. So I'm going to go ahead and turn it over to Kate.
Good afternoon, everyone. I'm happy to be able to do this presentation as an overview about COVID-19 with a specific focus on how to stay protected. So I'm not exactly sure who we have in the audience today, but please put some questions out there in the chat. We'll have time for questions after so I can make sure that I am tailoring this to your specific situation. I don't want it to be so generic that it loses meaning for you. So let's make sure that this is a meaningful presentation and assists you moving forward with your work and your personal life. My name is Kate Guzman. I'm the Administrator of Medical Services at the Oakland County Health Division, which basically means I'm over the Communicable Disease Unit, clinic, and the laboratory. So put all of that together and I'm doing a lot of COVID work. I've done a lot of swabbing and have worn a lot of PPE since March. So, settle back. I'll try to answer questions as best as I can. I'll just put it out there. I'm not an expert and I'm not a physician. So if there are questions that I can't answer, I'll be very honest about that and I'll work my hardest to get an answer for you and get back to you by the next day. Sound good, everyone? All right. I wish I could see some faces out there, but I'm imagining that you're all nodding at me. That being said, let's start. All right, so we've been saturated in the media about COVID-19, but just to give an overview so we're all on the same page for this presentation, the actual virus is called SARS-CoV-2, and that is the virus that causes COVID-19, which is the illness. So coronavirus, COVID-19, SARS-CoV-2, it's all kind of the same name to talk about the same illness, but it's an illness caused by a virus that can be spread from person to person. The virus that causes COVID-19 is a new coronavirus that has spread throughout the world. And currently, we are not ready to distribute the vaccine yet. Very soon, though, coming soon. Next slide. COVID-19 symptoms are varied. Every person that you speak with might have different symptoms. We have been doing what we call case investigations from March, and that's where we call everyone that has a positive test and conduct a really lengthy epidemiological interview with them. And so I have spoken with, I don't even know how many cases, and the responses that I've gotten about their symptoms have been so varied. But this slide gives you a good sense of the overview of symptoms that may be COVID symptoms: fever or chills, cough, fatigue, body aches, headache, sore throat, congestion, runny nose, nausea, vomiting, shortness of breath, diarrhea. This loss of taste or smell is a pretty indicative one. Next slide. And like I was saying, that people with COVID-19 have a wide range of symptoms, and they can range from very mild or even asymptomatic to really severe, leading to hospitalization, intensive care, and subsequently even death. Symptoms appear typically around day 4 or 5. That's the typical incubation period, but the range is between 2 to 14 days after exposure to the virus. So if that rings a bell in your mind, kind of thinking about this quarantine period that we've been talking about ad nauseum is 14 days long. This is the reason for it, because the virus can take up to 14 days for full incubation and to manifest. So if someone has been exposed to a COVID case, we put them in quarantine for the full incubation period of the virus, which is 14 days. Emergency symptoms that would prompt you to want to seek medical care immediately, include trouble breathing, persistent pain or pressure in your chest, confusion, new confusion. If you're always confused, don't worry, it's not COVID. Pain or pressure in your chest, confusion, inability to wake or stay awake, and bluish lips or face, which means that your oxygen is not perfusing through your body. Next slide. So how does it spread? What do we really need to be careful about? So mainly person-to-person transmission is spread through droplets as we're coughing, sneezing, talking, singing, yelling. Anything that's causing expulsion from the nose or mouth is a potential transmitting action. So droplets can land in the mouths or noses of people who are nearby and be inhaled into the lungs. Or they can also land on your hands, and then you touch your face and things get in that way. And although the main mode of transmission is not from surface transmission, from touching surfaces where someone has sneezed and you've touched it and picked it up and then rubbed your eyes, it is a known mode of transportation, which is why we stress the hand washing so much, as well as not touching our hands and face. We're going to talk about this more when we actually work through like how to put PPE on, but just kind of keep in mind this. The virus needs a way to get in, which is like a mucous membrane, like your nose, your eyes, or your mouth. Next slide. Are the people I serve at increased risk? What a great question, because it's definitely something in all of our minds. Who is the highest risk and where is the vulnerable population? And so the risk for COVID-19 does increase with age. However, people with any age, if they have an underlying medical condition, they will be at risk for severe illness from COVID. People living with disabilities may be at an increased risk if they have limited mobility and they can't maintain social distance, trouble understanding the prevention measures like hand washing or mask wearing. I know that that's a big barrier for people living with disabilities, or if they have an inability to communicate symptoms, right? And so maybe they don't have that loss of, or they have had a loss of sense of smell or taste, but they're just not able to express that to us. Next slide. So protecting ourselves is probably my main mission today in presenting this to you all. My goal is to make sure everyone feels comfortable and protected and has the information they need to, protect themselves. So regardless of where we're at work or at home, keeping a distance of 6 feet from others is essential, right? There's always the possibility that a sneeze can travel a lot farther than 6 feet. If you've seen any of those really cool videos online, you can see how far a sneeze really travels. But the likelihood of transmission of a virus drops dramatically after 6 feet. So even if the sneeze is still that 6 feet is the range where transmission is most likely. Wear a mask when you're at work. Also, if you're out and about anywhere in the community, I'll add that onto the slide. Wash your hands frequently with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol. And wearing disposable gloves when you're working with your clients or handling tissues, linens, doing laundry. Those are really important steps you can take to protect yourself. Next slide. So along the same lines of protecting yourself a little bit further, but also others, we want to frequently clean and disinfect surfaces. The touch surfaces are what we think about the most. So counters, doors, light switches, bathrooms, and kitchens are key. Using standard precautions should be your norm anyway, but if there's a potential that you've been splashed or sprayed by bodily fluids, follow up with your procedures that, your protocols that you have for those type of exposures. Always wash your work uniforms or clothes after each use with the warmest water setting and dry them completely. I like to take everything that I've got on down to my very most bottom layer in the garage when I get out of my car. And so, and that kind of just goes into a ball that goes right into the laundry. I wash my hands really good. And then you've kind of got like an under layer on, and I'm streaking to, the shower or the bedroom to change. Just my technique, but it's worked so far. Always monitor yourself for symptoms. If you're working in a high-risk setting or you're working in healthcare, we're encouraging monitoring in the morning and in the evening. So you're monitoring twice a day just to be sure. Don't go to work or care for others if you develop symptoms or you've been exposed. That's probably the thing you can do to help protect others, is to put yourself into quarantine if you know that you've been exposed, or put yourself into isolation if you have symptoms. Next slide. These are the touch points that we were talking about, but surfaces that are touched often or by more than one person need to be cleaned and disinfected regularly. just again, thinking about door handles are probably the easiest one I can think of, but even like shared phones and things like that, you put that right up to your face. That's something kind of really important to think about. The phones are really dirty. When a surface is visibly dirty, wash it with a general household cleaner, just soap or detergent, and then rinse it with water and follow it with a disinfectant. When the surface is not visibly dirty, clean it with a commercial product that's both a detergent and a disinfectant. And wear disposable gloves while you're cleaning, just acting as if the surface that you're cleaning is contaminated. Always act as if. Next slide. This is just a reminder for proper hand washing. I think it's a video, isn't it? It's just loading slowly. Caitlin, can you turn the volume on that?
Are you not getting any volume?
No, okay. I can't hear it. Does anyone else hear it? You can put it in the chat.
Nope, I wasn't getting any volume either.
Okay, give me 1 second.
This is our medical director, Dr. Faust, by the way, talking about hand washing. Just a little public service announcement.
How about now?
No volume.
Okay, 1 second.
I'll just pause and say, does anyone have any questions while we're working on this? You can type them into the chat. Technical difficulties, I love it, Trish.
We don't have any questions coming up yet. Caitlin,
Okay.
You want to make sure that you're sharing your system sound?
It is shared, so I'm not sure what's going on.
And double check your device settings in Teams as well. If not, if we have a link to the video, I can always add that in the chat as well.
Yep, we do have a link. Give me 1 second.
It's okay. It's been a day of technical difficulties on every meeting we've had. I seen Suzanne join, and I believe she had some technical difficulties this morning as well. Great. Thank you, Caitlin. Caitlin did put the link to that video in.
Thank you. Yeah, and we can just move on to the next slide. Honestly, the hand washing is not a scientific process. Just wash really good in between the cracks of all your fingers and on the backs of your hands. I think about it and I am like, I am pretending to be a surgeon now when I wash my hands. And so, this cursory just kind of rubbing them together under the water isn't enough. You really have to get in between and on the backs of your hands and even under your fingernails, especially if you've got long fingernails. That is just a hub for viruses to live and breed in. Not to freak everybody out. But Caitlin, we can move on to the next slide after the hand washing.
Yep, it's back up. I just want to confirm.
Oh, thank you. There's a slight delay on my computer. I saw someone in the chat that there is a slight delay even for me, and I'm connected and hardwired into the Oakland County internet. So I get it. We might all have a little bit of a delay. So caring for someone with COVID-19, which I'm under the impression that many of this group that's watching today or listening today are caregivers of some sort, going into homes, doing some services. And so these slides become more important when you're thinking about what if this person, this client that I'm going to see today has tested positive, but they still really need my services and really need my care. We can't just stop caring for someone because they have COVID-19. So what we need to do is protect ourselves the best we can. And so if there's a client that has been diagnosed with COVID-19, they should, first of all, be in contact with their healthcare provider and following their doctor's instructions for care and medication. The individual with COVID-19 should wear a mask if they're able to and isolate from other household members for at least 10 days. I can answer all kinds of questions about that if you have questions. It's very difficult for household members to isolate from each other, and we understand that, but we do have some tips and tricks that we can talk about. Caregivers should wear N95 masks and gloves when caring for someone with COVID-19. My personal opinion, maybe because I'm a nurse, but I believe very strongly in the eye protection and gowns as well. More the eye protection, to be honest, just because I've had, as a nurse, lots of things flash into my eyes. And so I really believe in that as part of the standard PPE. I would encourage it if you have goggles or the shield, and I'll be talking about those in a little while. Next slide. So when you are caring for someone that has COVID-19, we want to be very careful about how you're disposing of your used PPE, your used items like gloves and masks, and also any of the, the tissue and paper, things that you're using to clean people up. Just being very cautious how you're disposing of them and cleaning those surfaces when you're done. You're going to look for the emergency signs like we were talked about with the symptoms. So the trouble breathing is the big one. What I hear from people with COVID is a lot of this kind of like, oh, I feel like there's like bricks on my chest. I'm having a lot of trouble getting a deep breath in, these kind of feelings. And those are little red flags to you that they're, deteriorating, and you would need to contact their medical professional. The inability to wake up or stay awake, confusion, those are all reasons why you would want to call their medical provider. And if it's after hours, you would need to utilize 911. The other COVID precautions we've talked about in previous slides all pertain to this situation as well. Next slide. It might be my delay. Caitlin, will you go to the next slide?
Caitlin, you're muted, but it is showing that we're on the isolation versus quarantine.
Now I see it. Yep, now I see it. All right. So these are two words, isolation and quarantine, that have been tossed around a ton. I know in our own office we use them continuously, but they've been in the media a lot too. And they're words that mean very similar things, but apply to different situations. And so isolation refers to someone who is actually ill or suspected to be ill. So when someone has symptoms, they are diagnosed with COVID-19, or they're waiting for their test results, we put them into what we call isolation. So they're isolating in a separate room within the house, using common areas for at least 10 days. Quarantine, on the other hand, is while we're waiting to see if someone will get sick. So quarantine is for people who have been exposed to someone who has COVID-19 or any other virus that we're watching. This isolation and quarantine is not specific to COVID-19. These are, public health strategies that we use for other viruses and diseases. But quarantine is the 14-day period where we're waiting for someone to develop signs or symptoms after they've been exposed. So, that is probably the most painful process because they're feeling fine and generally just feeling really cooped up. But while they're in quarantine, they're asked to monitor their own symptoms and kind of do a daily check-in. We call it contact tracing, so that we're looking at like just checking in on symptoms and taking their temperature daily just to see if they are becoming a potential case, so that we could quickly get them tested and identify them as a case if need be. So there's a link on there where you can get more information, and also our nurse on-call phone number, which is basically a giant phone bank of really experienced public health nurses that are trained to answer just about anything and everything you can throw at them. So take that number down as a great resource for you if you're out in the field and you just have a general question about exposure or mask or something, and you just don't know who to call. That 1-800-848-5533 number is a great number to have on your person. Okay, next slide. Just, some other reminders, other considerations to take into account. Have a clear understanding of your guidelines and precautions before you're going out to service your clients. Plan for the accommodations and the modifications needed for each individual, because every household that you go into is going to be a little bit different. We know that. Plan ahead for essential outings, having masks, hand sanitizer, making lists so you're organized and can get things done quickly, and always continue routine medical care, even despite the pandemic. Next slide. This is the best part of the presentation in my mind. I'm hoping that you get more out of this. PPE, personal protective equipment. What is it? It refers to the apparati that we put on to protect ourselves. We use it in the medical field, and so that's my context for it. But I know that, across many industries, there are lots of personal protective equipment variations, right? So if you're working in a factory, the PPE is going to be different than working in a hospital. And then, the physician's level of PPE is going to be different than the clerical support staff. So PPE is varied, but we're talking specifically about PPE to protect ourselves from COVID-19 or the SARS-CoV-2 virus. So it refers to the gloves, face masks, eye protection gowns worn to reduce the risk of injury or infection. And direct service providers are advised to always wear a mask on the job. And gloves, eyewear, and gowns are also advised in certain situations. Next slide. Face masks. Always wear a mask when you're working. Masks should be worn by people 2 years and older, and they should not be worn by people younger than 2, people who are having trouble breathing, or people who cannot remove it without assistance. Choose a cloth face mask unless an N95 or medical grade mask is provided by your employer, or if you are caring for someone with COVID-19. This is probably, it might be a push point for me, but as a medical professional who experienced a shortage of N95s at the beginning of the pandemic, this point is very important to me. And so if you are, just out and about in the community, just, at Kroger, stopping for gas, that kind of thing, please don't wear an N95. Don't buy N95s or stockpile N95s, because the medical professionals caring for people with COVID or suspected COVID really need those masks. And we want to make sure that those stay available for those providers. That's my public service announcement about N95s. Next slide. Why should you wear a mask?
Do you hear sound now?
Yes.
Perfect.
Well, that basically said it all. That's a great video. But we're going to talk a little bit about masks for a moment here. So when you're choosing a mask, There are so many types out there. I mean, you can get them at the grocery store now. You can get them online. You can just basically get them anywhere. Where at the beginning of the pandemic, we were having such a hard time finding masks, and now they're available everywhere. So it should be easier for everyone to be able to find one that fits well, that they're comfortable wearing, that they can wear for long periods of time. And so what we're looking for when we're looking at, say, a homemade mask, so this is a face covering, right? It's a fabric face covering, compliments of my mom. What we're looking at is 2 or more layers of a washable breathable. So this is 2 layers of cotton with a interfacing in the middle. So it's got like a 3rd layer in it. You're looking for something that completely covers your mouth and nose. So you've got it up all the way and all the way down to the chin. So it's covering everything and fits snugly against the sides of your face and doesn't have gaps. So this model has a wire in it that I can squeeze around my nose, and it helps it fit all the way down to the side. So these are the facial coverings that we're talking about. They're not professional. It's literally a barrier, just a physical barrier that is holding your germs in, pretty much. You want it to completely cover your nose and mouth so that if you sneeze or cough, you're covered both ways. So all the people that you see walking around like this, as soon as they sneeze, it's out into the open, flying for 30 feet or however far a sneeze flies, right? And so we just want to make sure we're always, if you're going to wear the mask, wear it right. So the other models that you might see, we've got like a surgical mask, right? It also has the wire on the top, has the 2 ear loops. And then this is an example of an N95 that we keep talking about. And so this is a formed N95. There are some that are soft and flexible. Traditionally, N95s need to be fit tested. And so there would be a machine that's connected to here with a hose and somehow detects if it keeps everything out. It's amazing. It's a science that I can't quite explain it, but as healthcare professionals, we get fit tested for an N95 and sized once a year. And so traditionally, we only wear N95s that we are fit tested for. However, now in the context of the pandemic, we're left at the mercy of whatever N95s arrive. So we can't be as stringent about that, but just know that that is typically how an N95 works. It's issued to you in a size that you have been fit tested for. But the N95 also has the wire. This one has a little bit of foam on the inside to protect your nose and goes around the back of your head with straps. Okay, next slide. I think there is a delay. I apologize. Next, thank you. So when you're choosing a mask, again, don't choose a mask that has fabric that makes it hard to breathe. Like I've seen these kind of like plasticky ones or like a vinyl. I think it says vinyl on there. Don't choose any that have a valve in them. That valve actually lets the particles out, which doesn't protect anybody. And right along with my public service announcement, don't wear a mask that's intended for healthcare providers unless you are caring for someone with COVID-19. Next slide. Mask do's and don'ts. Wear a mask that covers your nose and mouth and fits snugly. Like we talked about, find a mask that with a nose crimp to avoid the fog on your glasses. So the better the fit, the less fogged up you'll become. And children will need a special size mask that's smaller so that it fits them better as well. Especially important as kids are all heading back to school these days and will need to wear a mask for example, 6 hours in a classroom. It can be very difficult for them. Next slide. I love this. I would put this in the back of my car and drive around like a billboard on my car. I have seen every variation of this, but this is just some humor about how to don't wear your mask around your neck, under your nose, only on your forehead, on your chin, on your arm, dangling from one ear. It just doesn't do any good, right? Next slide. So this is a good one. So once you put the mask on, consider it dirty. So this is potentially receiving any cough or sneeze or respiratory particles that have been shot at you by someone talking at you without a mask on. And so you have to consider that this whole surface, this whole outer surface is contaminated. And so that being said, you don't really want to put your hands all over it, right? So you're just going to touch it by the ear loops. And that's how you're going to take it on and off as you need to take it on and off. And then in addition to that, when setting it down somewhere, if you've taken it off, then don't put it face down somewhere. You're going to want to have a surface that's like your clean surface and put it clean side down, dirty side out. Okay. So just things to think about: clean side, dirty side. Less important with your fabric masks that you're just wearing out and about, but very, very important when we're talking about caring for someone with COVID. Fold the outside corners of the mask together. Don't touch your eyes, nose, or mouth, and immediately wash your hands after taking your mask off. Great tips. Always great tips. Next slide. Cleaning your reusable mask is essential, so it needs to be cleaned daily. If you have a cloth mask, a cloth face covering, it should be washed regularly. I want that to say daily. And anytime it gets damp or soiled, take it off. It needs to be washed. So you can wash it with your regular laundry, with the warmest water possible in that load, and using your highest heat setting possible until it's fully dry. That is just helping to kill anything that's on it. You know, if they can live through hot water and drier heat, you know, it'll be a hardy virus. Next slide. Glove use. So we should wear disposable gloves when you're touching clients that you're serving. So dressing, bathing, showering, transferring, toileting, feeding. If you're handling tissues or toiletries, changing linens, doing the laundry, cleaning surfaces. The interesting thing about gloves, just to kind of keep in mind, is that they're also very dirty once you have them on. These are specifically using these to touch things. So you always want to think about how you're going to take them off, right? So there is an art to it of grabbing it from the edge and flipping it inside out, correct? Everybody has seen that technique before. You hold it on the outside edge and flip the whole thing inside out as you're taking it off and put it directly in the trash. Okay, next slide. Wash your hands after you take them off. I'm sorry, I forgot the last bullet point. You can go to the next slide. I still see the glove use slide. I'm very sorry. Caitlin, have you advanced the slides?
I did. It is on the how to take off gloves slide with 1 through 3, the first 3 steps. Do you not see that up?
Now I do. Thank you. Sorry, I got a little bit ahead of myself. So you're grasping the outside of one glove and peeling it away. It turns inside out. And holding onto it with your hands. I'll demonstrate. I'll waste a spare gloves. So you've got 2 pairs of gloves on, or 2 pairs, I'm sorry, 2 gloves, 1 in each hand. And so basically, you can see my hands. You've got one, both hands are dirty. So you've got your gloved hand. You're not going to touch your skin on the inside, but you're going to grab this outer lip and fold it into itself. And then now that you don't have a glove on, you're going to slide your finger under the glove so you're not touching the outside contaminated part and flip them inside out. So you're only touching now with your ungloved hands the inside of the glove, so it's not dirty. You're going to toss it in the garbage and wash your hands. Next slide. Eye protection. So if there's a potential that you may be splashed or sprayed by bodily fluids during your work, wear eye protection. So I am guessing if you are toileting, bathing, feeding, if you're providing direct care, there is a potential that you will be splashed. So I feel like you should always have some sort of eye protection on when you're working, even not in COVID, just for standard precautions. But in the context of COVID, which we're talking about today, let's be super cautious. So the goggles that are listed on the slides are great examples. The ones on the top provide full protection because they go all the way around to the side. The ones on the bottom are a little bit less protective. Our preference here is the shield. And so as you see, I'm hoping that this is something you'll have too. It has like a foam piece here on the inside, and that's the part that goes against your forehead. So, and then just a strap across the back. So literally you just put the foam on your forehead and put the strap around the back of your head, and that's it. So you can see it comes down, and it also protects my neck and my whole face. I look like a beekeeper in that slide, but I love it because the gown only comes up to my neck, correct? And so there's this exposure between your gown and your neck that's really covered by the shield. I have experienced a sneeze and a cough right at me while swabbing someone for COVID, and they have splattered on my shield like a disgusting slow motion science movie. And in that moment, I realized, the first time it happened, realized that these shields are worth their weight in gold. I love my shield. I only wear it for one shift, and ours are disposable. You might have yours that are not disposable that get cleaned and disinfected, totally appropriate. But that being said, out of all the PPE that we're talking about, this shield becomes the most dirty. So you've got your mask on, but remember, your mask is now behind your shield. So your mask is staying clean on the outside now because the shield is protecting everything. And so this shield is the single most dirty / contaminated piece of PPE. And I want you to always think about that when you're touching it, because the tendency is to take it on and off because it's irritating to have it on. But the more you take it on and off, the more potential you have for cross-contamination and touching it. So try to leave it on as long as possible. And when you have it on, you can just pull it off by taking the back strap and pulling it off and holding it here by the back strap. Knowing that this front is the dirty part, you can handle it from the inside and lay it flat on a surface. Lay it flat on a surface if, say, you needed to go to the restroom or something and needed to take your shield off. And then putting it on, you would be very cautious, again, to hold it just to your forehead and put that strap back around your head. Okay. That's eye protection. Goggles are the same. Some goggles have straps that go around. Some of them have, your, what are those called? Your arms, like glasses do. Oh my gosh, I'm so sorry. Next slide, please. Gowns. So I prefer to wear gowns. Even today we're doing a drive-through flu clinic, and I have all the nurses wearing gowns with the expectation that someone coming through in a high volume clinic like that could potentially have COVID. So I just want them to be very prepared and protected. What I like about gowns the most is that you can get into your car feeling like you have taken that gown off and you have left any dirtiness, any virus, any contamination, you've left that behind at your work site, which is already, dirty. And so for me, that gives me a great sense of protection, so that when I get home, I don't feel like I'm carrying anything with me, or even my car, right? I don't want to bring anything into my car. I use it every day. And so the gowns go on, and they're all different, but most of them have a tie at the top that goes around your waist. And so my piece of advice for the gowns is just to think about it as covering all of your clothing. So if you've got something with a hood on, you don't want your hood on the outside of the gown, correct? Because then that whole hood is getting contaminated. It's not under the gown. If you've got a cowl neck on, or even like a necklace like this, everything is under the gown. So tuck it all under the gown, and even sleeves, right? Like if you've got long sleeves on, you don't want sleeves hanging out past the end of the gown. Correct? You're just kind of thinking about it. If you're working with a work partner at all, eyeball each other when you get this gown on, or when you get the PPE on, and look at each other and say like, hey man, your hoodie's sticking out, or whatever it is, just to give yourself a sense of like stepping back and looking at somebody and making sure that everything's covered. I find these gowns hilarious because they usually come in like a triple XL, and you probably can't see on the screen, but I'm not a very large person. And so they're usually pretty big. They can fit over all types of clothing. And most of them have a nice tight sleeve on them, which is really nice. When we put the gown on and we tie it all up, you put your gloves on over the gown. So you put the gloves on over the top of the scrunched end, of the end of your sleeve, so that it also holds it on tighter. Okay. Taking the gown off is the tricky part, and I can demonstrate if you want. It's kind of meaningless seeing it. It's easier to do it yourself. But taking it off is the most hard. it. So they're paper or some sort of cloth that's very paper-like. So you've got it on. You literally grab it here, pull it so that the ties break. You don't ever worry about untying your gown because you're not reusing it. You're throwing it away. So you pull it out from the chest with 2 hands, like a quick pull, and it breaks your ties. And then you've got it in your hands. You're holding it on the outside with gloves on. You've still got your gloves on. And you pull it all into a ball inside out, and your arms come out last so that all of the contamination is on the inside, and you've made an inside out ball, similar to taking your gloves off. The gown is contaminated. It is just like everything else I'm talking about. So, you know, if you've got your gown on and you're in the quote dirty area, say it's the bathroom or it's just that entire client's house, don't get in your car and wear your gown to the next client's house. That's not how gowns work. They're meant to be disposed as soon as you leave the dirty area and not to be worn into any clean area. I hope that that's very clear to everyone. You should have enough PPE that you can throw your gowns away and should never be wearing them from site to site to site, because then you're just carrying all of that contamination with you through your whole day. Next slide. This probably does a better job than I can, so let's watch the video.
Demonstrates the updated recommendations for PPE donning and doffing when caring for a patient who is suspected or confirmed COVID-19. Begin by performing hand hygiene using an alcohol-based hand sanitizer. Completely cover all surfaces of your hands and rub vigorously until dry. Next, don your isolation gown. Open the gown fully. Put your head through the opening and arms into the sleeves. Place your thumbs through the thumb holes. Fully extend the back of the gown to cover your backside. And be sure to secure the gown at the waist with the ties. Next, don your procedure or surgical mask. Be sure that the mask fully covers your nose and mouth, that it's pulled tightly under your chin, and fit the bridge of the nose. Next, don your goggles. Last, don gloves. Make sure they're the appropriate size. Put them on so that the wrist extends up over the cuff of the gown. Do a final check to make sure that your PPE is on, fully secured, and without defects. When doffing PPE, first break the gown tie at the waist. Grab the gown at the shoulders and gently pull until it breaks at the back of the neck. Roll the gown down and away from your body, taking care to not contaminate your uniform with the outside of the gown. Dispose of the gown in the waist. Perform hand hygiene. Prior to removing your goggles, don a new pair of gloves. Remove the goggles and immediately clean and disinfect with a hospital-approved disinfectant. Be sure to clean all surfaces of the goggles, inside and out, ensuring that they're wet for the amount of time specified on the manufacturer's instructions for use. Surface. Remove gloves. And perform hand hygiene. Last, remove your mask dispose it at the waste receptacle, perform hand hygiene one more time.
So my only critique of that video is that her hair is long and she's got this ponytail that every time she moved, I'm imagining her ponytail going into the toilet as she's helping someone transfer. So I would just add to their PPE sequence the idea of a Buffon Cap, and I forgot to bring it in my show and tell. So they're just the disposable hair caps. I mean, they make you look like a cafeteria worker, but that's not a bad thing because it's protective. And so we wear them at the COVID test site just to get one more layer of protection because, you know, many of us have longer hair. You can't see mine is longer and really unruly curly. And so the last thing I want is virus latching into my unruly curls. So I definitely put that Buffon Cap on as well. And the last bit of wisdom that I just want to put out for everybody is, if you're thinking about contamination and stress that somebody has COVID or might have COVID, and you have taken your PPE off wrong, or you've touched the front of your shield, or you've touched your mask or something like that, please don't stress. Always remember that COVID doesn't spread through osmosis. You're not going to get it if you accidentally touch your shield. You just need to wash your hands. Okay, that's the biggest thing. If you make a mistake taking your PPE off or you make a mistake touching something, just pause, do a really great job washing your hands, and get back on track. Okay, these are our local resources that we have. You know, I'd love to entertain questions at this point if anyone has some. Caitlin, just to make sure that is the last slide, correct?
I just have one more. So we have national resources as well.
National resources. These are important. Please take these slides. Just a ton of great information, probably too much information, but they're amazing, amazing resources.
Yep, and that's it. So if you want to go ahead and take questions.
Yeah, absolutely. Feel free.
All right.
Yeah.
We don't have any questions right now in the chat. I want to let you guys know I did put in links for the Oakland County Health Division website, as well as the Oakland Community Health Network COVID resource webpage for our providers, which is why you saw Christine Burke's contact up there. If you are a provider of ours and you need PPE, we have a website for that. Also put in the CDC COVID website in there as well, so you guys have all those links. So if you do have questions, feel free to raise your hand, put them in the chat. If you are joining us by phone, you can hit *6 to unmute yourself, and we'll go from there. So who has some questions? Kate, you did such a good job. I'm not sure if we'll have any.
I see someone has their hand up. Is it Sharon?
Go ahead and unmute yourself.
Sherry, so my question is, if you have a lot of those symptoms that you mentioned, like nausea and vomiting and just the whole, how important, where does the temperature fit in? Like, could you be a carrier or get it from somebody that doesn't have a fever? Like, so I just want to know about that, because most places just check for fever, and I don't know how safe that means.
Yes, Sherry, that is such a great question. So majority of people with COVID have some level of fever, even a lower grade fever. It doesn't have to be 104. It doesn't have to be a raging high fever, but majority of patients that diagnose with COVID do have some elevated temperature, but not everyone. So that fever, that temperature monitoring should always be combined with symptom checklist. They're meant to work tandemly, knowing that the temperature is not everything. And also knowing that maybe someone would say no to all the symptoms because they feel fine and maybe not even realize that they're spiking a small fever.
Okay, thank you very much.
You're welcome. I am extremely long-winded. I hope everyone learned something today.
I definitely think so. We did have a question about the recording of this training. So by end of the week, I will have the recording of this training up on the Oakland Community Health Network website under our training tab. And we have all of our recorded webinars up there for providers in case you want to rewatch any of them. Do we have any other questions? I was expecting we would have questions about the PPE that OCHN has delivered throughout the pandemic, but maybe we're doing a good job on that too. We don't have any questions on that either.
I put my email in the chat, and if anyone had a specific like what if scenario or very specific scenarios to households or anything, you can reach out to me over email and I can help answer those questions. I love to be helpful.
Okay. We do have one question about, is there still a shortage for gowns?
Not right now. That is interesting that you knew that, because for a while it transitioned from masks being precious gold to gowns being precious. And that was a lot harder because we do not have a way to really disinfect gowns very easily. So not currently. We were directed to reuse. Yeah, if you have to, okay, so shortages of PPE could happen again. It's a very realistic question and comment. If you were going to reuse your gown, you would want to take it off by the edges of the sleeves and not ball it up, correct? Balling it up is your way of disposing it. And so if you were going to reuse your gown, you would pluck it off with the ends of the sleeves very carefully and hang it somewhere. So you don't want to set it somewhere. You want to make sure there's a hanger available. Hello. Oh my gosh, apparently talking to Siri, sorry about that. And you would want to hang it somewhere and make sure that that's known to be like a dirty rack or a dirty place. And then if you have any way of disinfecting or decontaminating, even a Lysol spray, something, I would spray it down. A 3-day rotation is something that we've implemented even for our N95s, just knowing that COVID lives for 72 hours. And so if you had 3 masks or 3 gowns, you could rotate through them and then reuse the first one on day 4. So there's lots of techniques for shortages of PPE if that does happen.
Sherry, did you have another question? Or is your hand up from before?
Well, I thought I took my hand down, but no, I don't have any more questions. I'll keep trying to take it down.
All right.
UV, a reliable source for disinfecting. We are not using that, but that doesn't mean that it's not reliable. There are some medical grade UV disinfecting lights. I would be very cautious with, say, something you just easily buy on the internet. So UV is a standard tool for disinfecting. Say we have something like that in our laboratory that we use for laboratory equipment. So yes, UV can be a disinfecting tool. I think there's probably a ton of products out there right now that maybe are not up to par. So I'd be very cautious with that.
Great question.
It is. My own doctor's office has these like special UV lights in every room. And I thought, oh, I wonder how much they paid for these. And is this really doing anything? I was curious. It's a cool idea.
I have seen them on Amazon, so I'm going to guess that's probably not a good one.
I'm not sure. That's the thing. Like, in research, you wouldn't want to waste your money and have a false sense of security. Otherwise, I'd put one up in my garage where I strip down every day, right?
There you go. All right. I'm going to give you guys a couple more minutes to see if you have any other questions. Again, we are recording this. We will make sure to get this up on our website. I did put on the links to the Oakland County Health Division website. They have a lot of information up there on so many things. They're one of our wonderful local resources that we have for OCHN specific providers. We have a link on our website as well on the Oakland Community Health Network. And with that, if we don't have any more questions, I will go ahead and end the recording here and thank everybody for attending. And thank you, Kate, so much. This was so informative. Even as much as I thought I knew, I learned at least 3 new things today.
Great. Then it was a success. Thank you, everyone. Good luck and stay safe and healthy.